And it's tough for those success stories to offset the tremendous suffering and loss doctors and nurses have seen. When we're all shouting support for them from our window tonight at 7, we would do well to remember how many patients they've seen who've not recovered. Our medical professionals, often the only ones there to comfort patients on their deathbeds. And they themselves have lost friends and family members while putting their lives on the line every day. It does sound overwhelming, and it is. Rena Novini now shows us the mental toll this is taking on health workers and the effort to help them.
Doctors suffered from a suicide rate that was twice the national average way before COVID-19.
And that's why Dr. Calvin Sun is even more worried about his colleagues during the pandemic. Their hearts heavy this week with the loss of Dr. Lorna Breen. She was an emergency room doctor at New York Presbyterian Hospital and recovered from COVID-19 herself. On Monday, it was announced she took her own life. Her father telling NBC News she was in every sense of the word a hero who gave her life for her friends and her city.
I didn't know her personally, but my friends who worked with her at residency in Columbia Presbyterian, they're shocked. I mean, she's an ER doctor, so it doesn't matter if I knew her or didn't know her. She was one of us.
Dr. Sun says he and his colleagues are dealing with constant loss that takes a mental toll. Loss of their patients, their coworkers, and even their own family members. Dr. Sun just lost his own grandfather to coronavirus.
This is so much for me to, put on my plate. And if that's me, I think I have a very good support network system.
You can't even imagine what they're exposed to.
Psychologist Dr. Stratyner says he believes there are enough mental health resources available. The problem is changing the culture amongst medical professionals to normalize seeking help.
A lot of them feel like they don't have time to reach out for help. They're trying to save lives, and they are saving lives.
On top of saving lives, medical workers are also acting as support systems for their patients, an incredible burden on a profession dealing not only with a pandemic, but with a mental health crisis of their own.
If you're feeling that stress, talk to someone. There's no shame.
Rana Novini, News 4, New York.
Some crowds were bigger than others, making social distancing a challenge. People are anxious to get outside as quarantine fatigue sets in. Everyone is fatigued. CBS 2's Jessica Layton live in Weehawken tonight with more. Jessica.
Well, Maurice, that 8 p.m. curfew here in New Jersey is in effect, of course, right now. But earlier today, all of these areas along the waterfront were absolutely packed with people who've been cooped up for about 5 or 6 weeks now. Now, of course, it is certainly human nature to be going stir crazy. But you should know, if you give in and go out, it may come with a price.
So this is our homework setup.
We started out so strong, upbeat about homeschooling, family meals daily. But we've come to that point where those virtual cocktail hours are losing their luster, and staying inside has gotten stale.
It's hard to not know when the end is in sight. It seems like we've been doing this for a really long time.
Feeling cooped up from the quarantine, Jody Bogdanoff has still been strict with the rules. The biggest outing of the day is walking the dog. Politicians call the feeling of needing to get out social distancing fatigue. Psychologist Dr. Stratyner says it is dangerous, but it's a natural reaction.
And it's getting to the point where people are getting lazy. And so they're starting to go out. And they're not keeping 6 feet apart.
You could see that in the crowds that converged for the Blue Angels flyover today. Social distancing went out the window. Many marveling at the show in the sky weren't even wearing masks.
There are people who are willing to put their health after social connection.
Why are we willing to put those social connections against our physical health right now?
Because we're lonely.
The mentality of having done this for about 40 days already and still having several weeks to go is taking its toll. In fact, the word quarantine comes from the Italian word quaranta, which quite literally means 40. At NJGov even tweets out what day of the week it is, just in case you've forgotten. The lockdown lifestyle is frustrating, but doctors say it still has to be done.
And we have to reinforce each other.
And moms like Jody know the fallout from not following the rules could be even worse.
I'm concerned that if we get together too fast, we're going to have to go back and do this all over again.
In fact, that is what our leaders and our health officials are saying is exactly what will happen. Now, if you are complaining that you're bored at home, here's a little perspective for you tonight. There are still hundreds of people dying of this horrible virus in the tri-state area every day. In fact, in New Jersey, the number of people being admitted to the hospital for COVID-19 is still outpacing the number that are being released. We're live in Weehawken, New Jersey tonight. Jessica Layton, CBS 2 News.
Now back to the program. Joining us tonight again is Dr. Harris Stratyner, a counseling psychologist in Scarsdale and Manhattan. He's also a clinical associate professor at the Mount Sinai School of Medicine in New York City. So thank you for being here with us tonight answering these questions.
Pleasure.
So as this coronavirus reality goes along for days and for weeks, what have you been seeing with patients or people that you're interacting with?
A tremendous amount of anxiety and depression that falls into two classes. There are always individuals, particularly if they're older, who have had post-traumatic stress disorder, and they have more of a grief-oriented depression versus a reactive depression. And if we focus for a moment on reactive depression, that's reacting to the coronavirus, to COVID-19, where they're feeling like things are lost to them. They're having physiological problems. They're losing their appetite. They're not being able to sleep. And that's something that we doctors certainly can not only remedy with medication, but can remedy with therapy. And I know that Cable News 12 certainly talks about mindfulness meditation, and I think that's very important. There's a theorist by the name of Abraham Maslow, and in the early 40s, he wrote about a motivational theory, and that's one of my specialties is motivation. And it was called the hierarchy of needs. And he said that there are basically 5 categories. There are physiological needs that we have, where, you know, we have a need for air, for water, for food, for shelter, health. And that's followed by safety needs, where, you know, we have a need for personal security. And that's followed by love and belonging, familial love, intimacy, family, love. And after you look at that, you look at esteem, self-esteem. And we can see a lot of need for self-esteem because people lose their self-esteem when they feel like their safety is threatened. And that's something that we've got to be very cognizant of. And the last category is something that I would say very special people achieve, and that's self-actualization. A good example of that, we've got a documentary that's been showing on public television on the Roosevelts, and Eleanor Roosevelt was a self-actualized individual. She was out to do her best to help others, to give of herself, because she had all of the 4 preceding needs fulfilled. She was able to do that, and she was a remarkable woman. When you think of the coronavirus, it makes us anxious about every one of those needs of that hierarchy. We worry about air, obviously. We worry about food and shelter. Will we lose our mortgage? Will we lose our home? Will we not be able to pay bank loans? We worry about love and belonging. But before we go to love and belonging, we worry about safety needs. Will we be safe? Obviously. Will we be isolated? Will we get the coronavirus, and because of perhaps a preceding condition such as diabetes or a lung disorder, asthma, etc., that we will have difficulty being around because you have to be isolated? That frightens us. Then, of course, love and belonging, our family missing if we get sick, you know, and then, of course, our self-esteem. And you can even see self-esteem with the President of the United States, you know, with other leaders. For example, Andrew Cuomo, who's our governor, and I think, in my humble opinion, not to get into politics, has been doing an amazing job. You see, people want to have self-esteem. They want to feel good about the job they're doing. They want to know that they're capable of doing the job they're doing and that they're helping people and they're making things work, from the president to the governor to senators, etc. And then you get to self-actualization, where you really want to feel like you're helping your fellow man or woman. And those 5 hierarchy needs are absolutely affected by something like COVID-19.
And we have seen people pull together and, help each other out in this time. But if you are feeling those emotions of anxiety for any of the above reasons, how should someone address that? How should someone process it while they're potentially by themselves in their home?
Well, one of the things we have to realize is that we have something called existential angst. It's a fancy term. Psychologists like to use words a lot because in many states we don't prescribe medication, and several states we do. So we turn to language and theory and research, which is vital. And what often happens is that when people are feeling this anxiety and they're isolated in their homes, they're not feeling a sense of belonging, even with their families. They're feeling like it could be somebody who's the breadwinner or 2 breadwinners. We have 2 income households these days, and that people are going to let their children down. Their children are not going to get the education they need. As a result of that, we have to focus on existential anxiety and realize that what is, and this may sound cavalier on my part, but what is going to be is going to be. Now, that shouldn't make you depressed, because I actually think we Americans are going to pull through this. We've pulled through everything in our history. Whether you're in your 20s, 30s, 40s, 50s, 60s, 70s, 80s, we have always pulled through. We are a country of people who, as the governor said today in his daily report, are amazing and are there to help each other. And I think if we try to focus on the positive and we try to do a little exercise, so we raise our endorphins, which make us feel good, a certain chemical, if you will, to keep it simple, that makes us feel good. If we sleep and get enough sleep, if we take in enough nutrition, then we're going to make it through. And we're going to be able to actually enjoy certain things that go on. I'm enjoying the fact that I don't have to shave every day. That may sound trivial when you're going through COVID-19, but it's something I have to do as a doctor every day when I see patients. And it's kind of nice to be able to relax. Normally I'd have a tie on and a suit. So we have to try to have laughter. That's a defense mechanism of the ego. The ego is the self. And one of the things we defend ourselves with is laughter and humor. We're seeing a lot of that on the internet, a lot of jokes, because Americans have a sense of humor, even though this is not necessarily a time to laugh or a funny time. We've seen horrific deaths. We've seen a horrible death toll. But we have people, and I loved the opening of this segment, because you heard the kids thanking all of the first responders, nurses, doctors, firemen, EMT workers, psychologists, whoever works in the health profession. And it's just been amazing. People have been putting their own health aside to save lives, and that is absolutely amazing. I heard one story of a woman who gave birth very prematurely, and she is alive. She had coronavirus, and she's alive. The baby's alive, and those are the stories that make us feel good. And I want to say to young people, I'm a guy who's a lot older than the kids, and I will tell you that I've seen amazing things. We made it, particularly in New York. And we know that New York is very congested. We know it's an entryway to the United States. And we survived 9/11, and we are going to survive COVID-19. We're going to get through this. They're already coming up with studying vaccines. They're already testing people in greater ways, and we have to remain positive.
And that's what we will do. Yeah, we are. Our tagline now is "We're in this together," and we are. And we'll get through this together. And right now we're going to take a short break, and we'll be back with Dr. Stratyner in just a bit. So keep your questions coming on our social media pages, and we'll be sure to ask them. Welcome back to our coronavirus special report. I'm Gianna Gelosi. Joining me tonight is Dr. Harris Stratyner, a counseling psychologist, and we're just talking about the psychological impacts of this new reality. So we're getting through it day by day, but once the country kind of opens up and things kind of try to get back to normal, do you think there's going to be residual psychological impacts on frontline workers, maybe with PTSD, or just people in general, maybe being scared of their neighbors' germs or wanting to stay in their house? What do you think is going to be the reality?
I think the reality is that that's absolutely going to happen. And I think it's a very normal process, even though, strictly speaking, and you know, somebody who's like myself, who's been involved with media for so many years, as a psychologist, I always argue with myself, should I use very clinical language or should I use down-to-earth language? So, you know, that's not as clinically involved, which is what I've chosen to do. So I will tell you that post-traumatic stress disorder, if you've been in a war, for example, if you did experience September 11th, and many of us did firsthand, then something like COVID-19 is going to bring back some of those feelings. And ironically, that's very, very normal. And there are great ways to deal with that. There are wonderful medications, and there's wonderful therapy. It's really important that we take time out of our daily schedules and try to focus on relaxation. Focus, and this sounds ironic, but it's very important for COVID-19 because the virus loves to attack lungs. Breathing exercises, just trying to focus, closing your eyes, even putting a warm washcloth over your eyes and just trying to relax. Saying to yourself, there are two ways to get through this. One way is to drive ourselves, to use a layman's term, crazy. And the other is to say to ourselves, you know, I already live one day at a time. Many people, by the way, with addiction should be very aware that to deal with something like PTSD or to deal with exogenous or reactive depression, reacting to things, or anxiety disorders, that they really should be careful about what they ingest. Taking things like benzodiazepines, a fancy term for things like Valium and Xanax and other tranquilizers, which are highly addictive and can result in seizures. Drinking something like alcohol, which is a depressant. Alcohol is a central nervous system depressant. Its primary alcoholism is primary, progressive, chronic, and if not treated, fatal. That's the last thing we want to do. But at the same time, I understand that people want to, perhaps if they're of age and they don't suffer from alcoholism, let's say, want to have a drink or two or some wine. They need to relax. I would just say be careful with that. Be aware of that. And don't pick on yourself for feeling anxious, because I'll tell you, if you don't feel anxious, then I'd worry. We're entitled to feel anxious, and don't be afraid to reach out and get help. It's absolutely fine to reach out. There are a lot of organizations, the governor's office, I know, and mental health and the Office of Alcoholism and Substance Abuse Services have all reached out to me to try to help people, and to my partner, who happens to be my daughter. And that's important. We are going to get through this. And yes, just like you folks say on Cable News 12. We're going to do it together. And yes, we're going to worry for a while, even after this is gone. Oh my God, is it going to come back? Oh my God, what about the droplets in the air? Oh my God, what if the surface isn't cleaned? But you know what? We're dealing with whatever occurs. And there's a saying in AA, and I love Alcoholics Anonymous, one day at a time. Look back, but don't stare. Look back at what's taken place. Try to understand. Nobody's deliberately out to punish us if you're a religious person. Things happen, and things happen in our world, and they may make us very angry, and they may make us fight each other, but there's no room for fighting each other. I've seen racism. I've seen an increase in anger. That has to stop. This is nobody's fault. This is a pandemic, and it's something that, yes, 1918 with the Spanish flu, none of us, I don't think, were around. If we were, God bless those folks. But we're going to get through. I keep saying it over and over again. We are going to get through this. How do I know? Because I've been on this planet over 60 years, and I've seen us get through, again, September 11th. And I've seen us get through other things. I watched the President of the United States, Jack Kennedy, get shot. I saw Robert Kennedy get assassinated. And yes, we've lost many, many lives. I don't want to minimize that. I have had a number of patients who have lost family members. I myself have lost, to date, 8 close friends. But I've also seen many people get out of the hospital. And we, for those people in Westchester, we have wonderful hospital systems. Your segment with me is being paid for, I would think, by Montefiore. Excellent hospital with relationships. Our hospitals work together. And we've, again, I can't say enough about our governor. And I have no affiliation with the governor. This is not about me being a Republican or a Democrat. I just am very impressed with his daily reporting, and all of the doctors like Dr. Fauci, Dr. Burke, I really am impressed with the work they're doing, and all of the countries that are trying to find a vaccine and to make sure that people have antibodies and that they're going to have long, healthy lives. And instead of focusing on whether we're going to see another day, instead of focusing on whether it's cloudy out or it's sunny, just like the weather. Tomorrow, I understand, it's going to be sunny. Today, it was cloudy. And that's the way life is.
That is the way it is. And again, that seems to be the theme. We're taking it one day at a time. We're in this together. We're going to take a short break, and then we'll be back with the doctor answering questions. So if you do have any, send them in via social media, and we'll get them answered for you. We'll be right back. Welcome back to our coronavirus special. So tonight we've been talking with Dr. Harris Stratyner, a counseling psychologist. So doctor, what message would you like to leave with the audience? We have about a minute and a half left with you. So what would you like to tell them?
One of the things that psychologists use a lot is something called CBT, cognitive behavioral therapy, where we change the way you think in order to change your behavior. And in changing your behavior, it restructures the way you think. And that's a method that you can do even on your own. The other thing I want to mention is all of the self-help programs. I happen to be on the board of the National Council on Alcoholism and Drug Dependence of Westchester County. And I've seen people who have not been in the greatest health, who come to the meetings, who raise money, who save people's lives, who have addiction. You know, right before this coronavirus, we were really very, very worried, and we still are, and disturbed about opiates and all the lives that have been claimed by opiate abuse. And we have things like NCADD that are looking to help people. And all you have to do is go online and look them up. I don't have their number offhand, but I will tell you that they're wonderful, wonderful work. And know that your mind is powerful. The mind and the body are one. Think positively. It works.
There you go. So the theme of tonight with Dr. Stratyner, take it one day at a time. We're in this together. And if you need help, Seek it out. It's there for you. You can find out more about Dr. Stratyner on our site, and we'll have resources there for you as well. So thank you for joining us, Dr. Stratyner, and stay with us for more on this pandemic.